Hello and welcome to your daily Sex IQ question at 5MI Weekly. Today's question concerns the psychology as well as the biology of penile erections. Before sharing today's question, let's do a quick recap on what we've learned thus far from our Sex IQ test. We've learned the average age people are first engaging in sexual intercourse, the percentage of men having extramarital affairs, the percentage of women who have engaged in anal intercourse, the probability of transferring HIV during intercourse, the hardiness of HIV, the biology of personal lubricants, how expansive sexual experiences are, the fallacies of gaydar, the relationship between menstruation and pregnancy, the effectiveness of birth control, the goings-on during gynecological examinations, and the importance of testicular self-examinations. What will we be learning today? True or false? Problems with erection are most often started by a physical problem. Give yourself a point if you said true. Only 35% of Americans got this question correct in 1991, and only 44% of Americans got this question correct in 2016. This question's answer is controversial because it's based upon an assumption. It assumes most erectile dysfunctions are caused by physical problems because the most popular medical treatment for erectile dysfunction uses physical means, specifically drugs. Although physicians have a variety of tests they could use to determine the causes of erectile dysfunctions, most physicians only use a patient's sexual history to determine drug therapy to be the treatment of choice. One of the tests available to physicians, called a nighttime erection test, can easily determine if a patient's erectile dysfunction is due to physical or psychological problems. Every time a healthy man goes into REM sleep, he'll get an erection. For every 8 hours of sleep, a man typically will have about 5 REM stages of sleep, and therefore 5 erections. If a man's erectile dysfunction is due to physical problems, then he won't have erections when he's sleeping or awake. If, however, his erectile dysfunction is due to psychological problems, then he'll have erections when he's sleeping, but not when he's awake. So what's this all mean? Without consistently determining if psychological factors are causing erectile dysfunctions, the healthcare system may be systematically misdiagnosing, overdrugging, and maltreating millions of men suffering from erectile dysfunctions. That's all my time for today. Be sure to keep a running total of the number of questions you've answered correctly and the type of question you've answered correctly as well. Today's question was a biological as well as a psychological type of question. See you tomorrow for Sex IQ question number 14, a biological as well as a psychological question about sex therapies.